Hey guys, welcome to a new video. So in this case, we will be treating a patient who presented with some chipping on his lower front tooth on the lingual side. And if you like this video, please leave a like and subscribe for more. Thanks.
So what I wanted to try in this video is do some live commentary on the full treatment. And I thought it would be good to first start and introduce myself, because I've never done that on this channel. My name is Fede, I am 27 years old and I live in a quite small city in the Netherlands. It's called Nijmegen, and I've lived there for the past 10 years almost already. I followed my study dentistry in Nijmegen as well at Radboud University, and I finished 3 years ago at age 24. And I've been working since then in different practices, not only in Nijmegen, but as of now I'm only working in some practices in Nijmegen. The reason I'm doing this channel in English is not because it's my primary language, as you maybe can hear. It would be way easier for me to do it in Dutch, but I didn't find a lot of channels where dentists do live commentary on a full treatment. So I thought, to reach out to most people, it would be better to do it in English. And I hope you can forgive me for my English, that it's not perfect, but I'm trying my best, I can promise you that. So what you've seen me do here is prepare the tooth to smooth up all the sharp edges, and this helps make the new filling stick better. And after we have smoothened up the defects, we prepare the tooth even further with a blue adjuvant, as you can see over here. This blue adjuvant is a phosphoric acid, 38% in most cases. And this is all to help stick the new filling better. We rinse that off with some water and we blow it dry with air. And this drying is very important, because if there's any moisture present, the filling won't stick. So this is maybe even the most important step. And that's also why we work with isolation. The blue cover dam you can see me having placed here already. After we have dried it, we apply a primer. And this primer is mostly for the dentin, which is underneath the enamel. It is presented a little bit over here, not that much, and we dry the primer as well. And after that, I applied a bonding agent, and we blow dry that as well with some air. You can compare this bonding agent with a glue that helps stick the filling to the tooth. And this bonding agent also needs to be activated. And for this activation or polymerization, we use a UV light. And we do this for at least 10 seconds, because if we don't do this, the composite material wouldn't stick to the bonding agent and the bonding agent wouldn't stick to the tooth. So here's a final look of the defect, all ready for a filling. And in a case like this, we use a material called composite. And we can choose between different kinds of composite. We have a composite for the posterior teeth, molars. This is a much stronger composite, resisted against chewing and biting. But in a case like this, on front teeth, we mostly use an anterior composite, because this is better for the aesthetic appearance of the final filling. As you can see over here, we place the first layer of composite, and in this case I remember it's also the final layer because it's such a small defect. In most cases we try to apply thin layers of composite, and this has mostly to do with the polymerization of the material. You can see it's quite soft right now, but if we use an UV light, as you have seen in the bonding step, then we harden out the filling. But for the UV light to penetrate through the composite, it is necessary to work in very thin layers. But in a case like this, the UV light has all the room to penetrate all the way through it. So that's why I chose to only apply one layer of it. After I've shaped most of the composite and removed the excess, I give it one final look, and sometimes you can see from a different angle a very tiny part of composite that doesn't belong there, and we can remove that small part of composite with a very tiny instrument. This shaping is helping to make the polishing of the filling way easier. So that's why I take some time for this shaping step. And after we have given it a second final look, we use the UV light again to polymerize the composite filling. And this step takes at least 20 seconds. I like to do it even longer. And after this polymerization step, it is time to smooth up the filling, and that's also the final step of the treatment. This polishing of the filling is to make the bite good and all natural for the patient. And that also means that this is the end of the video. I hope you liked the video, and if you do, please leave a like, and also let me know if you like the commentary. If you have any tips or tricks for me to do it better, please leave a comment and subscribe for more. Thanks.